Hello, I'm Dr. Mira Irons. I'm President and CEO of the College of Physicians of Philadelphia. Welcome back to our series of interviews with experts in medicine, science, and public health that are focused on public health in Philadelphia.
Hello, I'm Dr. Thomas Fekete. I'm chair of the board at the College of Physicians of Philadelphia, and I also serve as the chair of the Department of Medicine at Temple University School of Medicine and Temple University Hospital. I'm also a board-certified infectious diseases doctor and an internist. My pleasure to be here today.
Great. So let's get started, Dr. Fekete. Given the fact that we are now almost 2 years into this pandemic, I think none of us thought we'd be here at this time, and I'm not sure that many of us thought that Omicron would have arisen and we would have seen a surge as large as we had now. What are your thoughts about where we are currently in this pandemic, and what does it mean?
Boy, that's a really good question. I wouldn't have imagined in January 2 years ago that we'd be anywhere near where we are now. And as you remember, this really took off in the US right around this time in the winter of 2020. Philadelphia was very hard hit, as you remember, from about March through the end of the spring. And then I think it settled down a little bit. But boy, those were rough days. And I had hoped that if we could develop a vaccine, which we did launch in December of 2020, we'd be seeing the end of this sometime in 2021. Guess I was wrong about that. This virus turns out to be unbelievably clever. And we've had several waves based on variations in the virus, some of which seem to make it more severe, some that make it more transmissible, and some that maybe do a bit of both. So it's a tough question, but I think that if we continue to maintain our vigilance, we might be over this surge sometime in February or March. And if we're very fortunate, by the time we get through this, enough folks will have gotten vaccine or infection to make the next one much smaller and much less scary.
So to that point, at some point we're going to move from pandemic to endemic. And we're hearing a lot of different expert advice. Many of the infectious disease and epidemiology experts are now saying this is the path. Omicron is the path to a more endemic form of coronavirus that we'll just learn how to deal with, moving forward. And others are saying, wait, not so fast. We don't know when the next Omicron may arise because of the vaccination status of the world right now.
So a good question too, because that's correct. We do not know when the next Omicron, or whatever Greek alphabet letter we haven't used yet, will be. I think that if you were to map out what happens with other things that become endemic, some of them remain at some fixed level, which is understandable, and maybe over time with good vaccination that can be chipped away. Others, like influenza, have these rises and falls. As you know, they're mostly winter for influenza. We see the most influenza in the wintertime, but not every year. We've seen influenza in the spring and summer. So it's very hard to know. But here's what I hope happens. I hope that if we do see an endemic version of the virus, that number one, it's relatively gentle on the health system. That's been beat up so badly by this virus. Number two, we know more and more how to manage the severe cases. Number three, we have treatments for early disease that will prevent it from becoming severe. And number four, we can heal over all the rifts we've had in our culture and our communities to make this not a matter of great political heft, because to me, this is very sad. It's a medical issue and not a political football or punching bag.
And to your point about the healthcare system, just to dive more deeply into that, when we look at new cases, they're starting to come down in the Northeast, in the southern part of the country, in the West, they're still starting to rise. Healthcare system seems to follow by 2 to 4 to 6 weeks. What are you seeing at Temple?
So at Temple, we have had several different approaches because it seems like whenever we have an approach, it's the right one for that moment. And in the beginning, we actually would cohort all the people we knew to be infected. And we actually had pretty good access to diagnostic tests. We were pretty confident we were doing a good job with that. Most people that came in with COVID were sick with COVID. That's what we saw in that early phase back in 2020. Now we're in a situation where most of our patients with COVID are coming in for other problems, and they're being picked up by screening in the emergency department or by the hospital staff. That produces problems because we now have our patients all intermingled on the regular hospital floors, and we're asking our nurses, our therapists, our doctors to be able to move back and forth from the special isolation for those patients to the average patient on the floor. That's been a bit of a challenge. Also, this particular wave has produced a lot of illness in healthcare workers. It is very hard to find healthy nurses, healthy residents, healthy respiratory therapists who are willing to work the long, arduous hours. So we've had issues around that. And of course, we've heard about these supply chain issues. It's difficult to get a lot of things. I don't think I put the same gown on twice. I think we just get what we get and hope it works, right? So Temple is doing okay because I think we've become a little bit hardened and we know kind of what to do. But this can't go on forever. And I think Temple is doing better than many because we do have, fortunately, a good staff and a good sort of attitude about it. But it's brutal. And the places that are struggling are rural places where there's no reserve, places that are financially very, very weak, and especially places that can't do their normal business because hospitals are also businesses. They're not just healthcare providers.
It seems as though, when I think back to the spring and summer of 2020, when much of the country was locked down, hospitals were canceling elective surgeries, elective appointments were canceled. People with conditions that needed clinical follow-up were scared to come to the healthcare system. I'm starting to hear that's happening again. So now you have potentially 2 years worth of people who have neglected therapy for chronic conditions. What do you say to those people?
It's so complicated because we have people, even kids, not getting preventive therapies. We have adults who don't know how to get or how to access their normal treatment for chronic diseases, people who are afraid to go for screening tests that are really vital, and then providers that don't know kind of which end is up because the rules change regularly. Hard to keep your other patients protected in the office when people are coming and coughing, and the questionnaires of how to tell if someone's sick are very confusing and they sound like everyone should be saying yes to everything. So this has been a huge challenge. When you look at COVID and the number of documented cases, then you look at the number in society of excess deaths, there's clearly a bubble. It's not just COVID that's causing deaths, it's poor access to vital healthcare. Ironically, people are going to the ER to get tested, and so they're waiting hours coughing in the emergency department, so anyone who doesn't have COVID may be exposed right there in the ED. This is not good. And again, this is part of that craziness with our supply chain issues and people's anxieties that are wound to a high level. I don't know what to say because these are not easily solved problems. And then, as we didn't talk about yet, but the Great Resignation, where people are just getting burned out from a lot of jobs and decided they don't want these jobs, has resulted in people shortages, a people supply chain problem. So again, these are all kind of working together in a funny way, synergistically, you might say, to produce all kinds of new challenges. We're good at challenges. We don't want too many, though.
Now that home tests are becoming more available, the government is going to start mailing them out in a few weeks, the 4 tests per household. What do you say to people who are generally healthy, right? They don't have a chronic disease or they're not, over 65, who have a positive test at home? What should they do?
Well, first of all, the home tests are pretty handy and they're easy to use. I've used them myself and they are luckily very easy to use, which is great. They're not perfect. And the home tests, when they're positive, are pretty reliable. I think they're about as good as most tests, but they fail to find true positives when A, the person may have a low burden of virus, or B, the test just not picking it up. So I think for a positive, you would say, this is something of alarm. I need to think about my behavior now. And certainly at the very minimum, be very rigorous with masking, avoiding crowded places, and perhaps not going out to restaurants or places that other people are congregating, even though you may want to. I know all of us want to, because that just is the right thing to do.
Yeah.
And probably it's prudent to keep away for at least a week from the home test positive result. But don't test yourself every day. That's unnecessary, and it doesn't take into account these tests are hard to get. The people who test negative are the ones I struggle with because there are the respiratory viruses out there. This is winter. We know we see influenza and rhinoviruses and all kinds of other things, and there's no home test for most of those. Mm-hmm. So it could be you have a different virus, or it could be just testing negative but you have COVID. So again, if you don't feel well, stay away from other people as much as you can and wear a mask. These aren't terribly difficult rules, but they become complicated. And as far as masks, whatever the mask you have is the mask you wear. If you can wear a surgical mask, that's probably a hair better than some of the commercial cloth masks. And if you can stand N95 respirator masks, which are fine, they're just a little awkward for some people to be wearing, especially whiskered people like myself, that's the best you can use. But you don't have to use that, just be using something.
Okay. Now that there are antiviral therapies being approved by the FDA that are very effective in keeping people out of the hospital, how should primary care doctors think about prescribing those to their patients if they get a call saying, I have a positive test.
Right. The treatments that are out there are varied. They're not all the same. And there'll be new ones coming along, I'm quite sure. So each treatment has its own special sauce. It's like you have to think a bit about what this medicine will do in the context of the patient and their underlying conditions. The most promising of the oral treatments has a medicine in it. It's a combination pill that can alter the way other medicines in your body are being disposed of, and it can make you have exceptionally high levels of those medicines. So if you call your internist or your family medicine doctor and you're already taking medicines, please ask that person to check with a pharmacy or check themselves, is this safe to use? For 5 days, it probably is. I wouldn't worry a lot about it, but just be aware of it. The other products out there have other issues, so you have to kind of keep aware of that. Our docs are really good at doing this, but it's stress. And these telephone calls can be at a bad time. You can be exhausted and forget something. So ideally, you'll go and understand a bit about it before you call, so you understand some of the things you need to ask questions about. And then the doctor will probably instruct you to pick them up at the pharmacy directly rather than come in for the script, because there's no reason for someone with COVID to come in and cough in the middle of a crowded office. And hopefully that system will work out. Again, the medicines aren't available in abundance yet, so there may not be a point of this exactly today, but I would like to think within a couple of weeks we'll be there.
Getting back to testing, the calls that I'm starting to get, really from friends, is what about swabbing your throat instead of your nasal area? I seem to hear, things on both sides of that.
Well, I think a lot of us are a little squeamish about testing ourselves to begin with. I know that a lot of us don't like sticking things in our nose, which is an unpleasant thing to do. And then if you are using the commercial tests that are available, they have a little, like a swab, and do you put it in your throat first or your nose first? And either one is kind of icky.
Yeah.
I don't think we have a good answer. Maybe your nose first, then your throat, I don't know. It looks as though for some people, the throat is just a little bit better a specimen. And if you can do both, that would be ideal. But like I said, I think that the approval of these tests is how they were first presented to the FDA, under which they got their authorization. But I don't think it's wrong or bad to try to be a little bit more aggressive and try to get 2 samples with 1 swab.
Okay. What do you tell people right now, understanding that people are just tired? This is like COVID fatigue to the 10th power. And a lot of people let their guards down when the numbers started coming down. It was sort of that pre-Omicron nirvana that the country seemed to be in or started to be in. What do you tell them now about how best to protect themselves and their families? At a time when we're hearing mixed messages, in Philadelphia, to go into a restaurant, you need proof of vaccination. Not so over the bridge in New Jersey. How do you tell people to protect themselves and their families?
First of all, I tell people to take a breath and try not to let this become overwhelming. I think some people struggle with that in their everyday lives. This would just push those buttons even further. Then I tell people to try to be kind. Sometimes when you're angry or frustrated, that's not the first thing you think about. But if you can just catch your breath and be kind, I think that'll pay back in multiples, many more times. I think that people should try to understand as best they can that every life decision is some risk involved, whether it's putting your socks in the morning or going for an airplane flight or eating at a restaurant in the COVID era. And you have to understand that you are taking these risks whether you asked to or not. If you understand that the risks are there, and if you feel that you've done what you can do, which is to take the vaccine, to be attentive, not to overdo the congregation that we have sometimes done in the past, and you need to get out, I say then go out. Don't spend your whole life in this bubble, because I can't say it'll be over in a month or even in a year. And we need to have human lives too. If you are potentially very ill, if you have, let's say, an organ transplant, then you might be a little bit more risk averse and you might ask someone to pick up food for you and bring it home. That may be the best you can do. But for the average healthy person, I think you can say that there's a slight mix of risk-taking that is reasonable and there's crazy risk-taking. And I think we all understand what that looks like. If you want to drive, drive. Don't drink and drive. I think we know that there's nuance to all these recommendations. And the same is true for COVID. If you got your vaccines, if you're attentive to your health, and you happen to go out and be with people, that isn't perfect, but it may be good enough.
Okay. Any suggestions on how we can meet people where they are with regards to their concerns about the COVID vaccine and get them to a point where they're comfortable with being vaccinated?
That's difficult. I think a little bit of it is the messaging around the vaccine's been confusing. We have multiple different vaccines. Each of us has a slightly different set of issues and characteristics, and I think people have found that frustrating. I know that doctors have found it frustrating. I think most people are willing to take a vaccine. I think there has been an exceptional amount of fear-mongering for reasons I don't really understand, to be honest with you. And if you look at sort of the so-called science behind that, it's pretty soft. Yeah. People have found whatever little shreds of evidence they have found and tried to build a case that these vaccines are dangerous or the vaccines are questionable. I don't know what to say, because if you look at the news, every day you hear about a prominent celebrity who refused to get a vaccine and became deathly ill or died. And again, I take no pleasure in any of that. That's a tragedy. Every time a person gets sick, that's a tragedy. But I think to myself, what was it about this vaccine that was so alarming that you're willing to take a chance on actually dying? I don't quite understand that. Even if it's not for yourself, even if it's not about your own health, protecting yourself protects others. And that's really a public good. And I think we have to ask ourselves, am I willing to make a sacrifice, even if I perceive some risk to myself, that will put a protective bubble around my loved ones? I don't think that's so hard. So I don't know how you tell people that, because a lot of people have stopped listening, to be frank, and maybe there's no opportunity for that. But I think that's where I'd start.
Yeah. Well, I think that to your point about protecting yourself protects others, it's a conversation we really haven't had nationally. We talk about it during influenza season every year, but with many of the childhood preventable vaccines, so many children were vaccinated that we didn't have to make that point. You were getting your kids vaccinated, but that public health point didn't have to be made. And now we're making that, and it's falling a little flat.
Yeah.
Because it comes back to personal autonomy, which I understand, but making a decision for yourself in this situation is going to affect others, or may necessarily affect others.
I don't know how to get people to kind of incorporate that. I think they'll understand it before they act upon it sometimes. And I've talked to people who've had what they think are legitimate concerns, and I don't feel, for me, at least from my perspective, they're legitimate. But they built up a barrier around those, and they protect them in ways that I don't fully understand, to be honest with you. And I think most people are actually able to get past that, but there are people who can't. And then this misinformation train has left the station, and it's still chugging along. And I think that's really a tragedy, because that, I think, is a mix of pseudoscience and sort of trying to interfere with people's judgment in a way that I think is tragic. If I said to you, I'm taking the seatbelt out of my car because I don't believe it saves lives, you'd look at me like I had three heads, and you'd say, well, why on earth take it out of the car? At least don't wear it. I mean, I think some people have moved to the taking it out of the car level of fear, not just the I'm not going to wear it level. I don't know how you bring people back from that. I hope they can understand that. And maybe a little bit of having all these mandates in restaurants and so on is just a bit of a push for some people who really aren't interested in doing it, but don't want the inconvenience. They don't want to live in a world where things are closed off to them. I don't want to say that's the right way to handle people's behavior, but maybe that gets a few more people into the doctor's office to get vaccinated.
I know on the pediatric side, so I'm a pediatrician, there's a big concern that the concerns about the COVID vaccine are actually going to sort of bleed into the anti-vaxx movement for preventable childhood illnesses. And there's some data to show that orders for vaccines have decreased and fewer children are getting vaccinated, at least there was early on. What are you seeing on the adult side? Do you have concerns that adults aren't going to get pneumococcal vaccine and zoster vaccine?
Yeah, so I guess the good news for adults is that the vaccines adults tend to get are either travel vaccines, and people are motivated to take those because they're traveling, or they're sort of more routine things that are more quality of life protective than life protective. The influenza vaccine is probably the most critical one, and that's not the world's greatest vaccine, as we all know. The pneumococcal vaccines are also not great vaccines. If somebody wants to skip that vaccine, I give them a pass. If that's the worst crime they're going to commit, that's okay. The vaccine for shingles, there's two of them. One of them is better than the other. It's to protect your health and your comfort. And while it's a rough vaccine for some people, it's pretty protective. And I think you would have to weigh for yourself whether you're willing to take a chance on some nasty side effects you pick up early after the vaccine versus what is a very painful, possibly chronic condition. I think it's a tough call. The other adult vaccines are much less critical, the tetanus and so on. Those are really kind of not as crucial. Whereas the kid vaccines, those are critical.
Right.
They're lifelong.
For your last question, I'm going to shift a little to the college. You've been associated with the college for a very long time. You're chairman of the board. You've been on the board of trustees for what, 13 years. What do you think the role of the college can be to help get the message out, educate people, advocate for public health?
Well, the college has certainly blossomed even in the last 5 to 10 years, and I'm so proud of the college for being a part of the civic conversation on a lot of things. And as you know, our former head of the Mutter Museum, Dr. Hicks, before his retirement, put together a brilliant display about the 1918-1919 influenza pandemic. Does that sound familiar? And then, of course, the next thing happened, we closed the college, But there's a lot that happened then that is really almost prescient now. It's almost eerie how the echoes of that have come back to us in terms of all the things you're worried about. Congregation of people, taking precautions to protect yourself, healthcare systems being overwhelmed, and so on and so forth. So the college has already done that. The college also, and this is I'm very proud of as well, the college has put together probably the #1 resource around the history of vaccines anywhere in the world. The resource is available online anywhere you are. It's been translated in a number of languages. People from all over the world look at it, and it's been very informative. And I think people bring a little less worry or credulity to it because they see it as just out there. It's not knocking on your door. It's not yelling at you. And that's been a huge resource. Also, the college has been the home to, or the affiliated home of so many people critical in the development of vaccines, really going back to the beginning of the 20th century. I'm very proud of that history. And those people are still sort of suffused into the college. They're part of the zeitgeist of the college. And I feel very proud to be part of that fraternity or sorority. So I think the college is already there. I think the college is going to continue to find ways to encourage, to inform, and to give people a place they can go safely and make their own determinations with, hopefully, the best information. And when they come in here, I have to say this is true for me, it's a very serious place to be, but it's not serious in the bad way. It's serious in the good way. You're seeing people learning and looking at life experiences that others have had and picking up from that. There are all these portraits of former physicians in this community who did things in their era that were very important. And we want to continue that tradition. Hopefully we'll have more diversity among the leaders. But I think the college does provide a kind of a safe place. People can come and see the history of medicine right in front of them. And Philadelphia is the birthplace of American medicine, and the college is that maternity ward, basically. And so I hope the college can continue to do this. And if I could just make one comment, the hospitals have done a fantastic job under very difficult circumstances in our community. And the hospitals provide services that have become something of a public health service. And so I think the college can kind of partner with those institutions, whether it's doctors' offices or hospitals or clinics, to provide a breadth of access to all the resources. And I hope that that looks like the kind of synergy, the kind of cooperation that healthcare is supposed to be about. We've had a rough couple of years. People are at the rope's end. I hope they can continue to come to the college, enjoy a little time here seeing what we have to show, and go home informed and refreshed, and then take on these challenges for themselves.
Mm-hmm. Great. Thank you so much for taking the time to talk to me today. Thank you for everything that you do. And thank you all for listening in. We'll be back in a few weeks with the next in a series of interviews on public health, medicine, and science.